All right, good morning, everyone. This is James Fuccione from the Massachusetts Healthy Aging Collaborative, funded and supported by, as you might expect, Point 32 Health Foundation. You may see a theme running through some of the presenters here, but we work with and for all of you to promote and support inclusive age and dementia-friendly communities, and what we're here to talk about with this panel is the inclusive part of that. You heard an angle of it with the dementia-friendly design considerations and how to be inclusive of people living with dementia. But like with many things, we rely heavily on partners to provide the examples and to help communities take action in being more equitable and inclusive. So today, we'll be joined by Carlene Pavlos from the Mass Public Health Association and Marvin Venay from Tech Goes Home to talk about just different ways on a statewide and local and regional level, communities and people and organizations are taking action to be more equitable. And we'll talk about why this is important, besides the obvious. Just from the outset of the World Health Organization, AARP, promoting age-friendly environments. Of course, ideally you could see this and read this writing, but if you can't, unlike this slide, we hope age-friendly environments are accessible, equitable, inclusive, safe and secure and supportive, and recognizing that older people play a crucial role in community. It's not just older people that need services and supports and are being served. It's about older adults being contributors and being key assets on a local level. The dementia-friendly environment, you heard plenty of that from Patty, but the main point of that is that while this started out as a social environment and awareness-raising movement, it is now both in the physical and social environments. It's about raising awareness, kind of so we can all be inclusive just in our interactions with other people, but also when we design buildings, outdoor spaces, and certain features to be inclusive on that way, in that manner as well. So in working to become both age and dementia friendly, we had two separate frameworks that Patty, myself, our Executive Office of Elder Affairs, AARP, UMass Boston, a lot of Mass Councils on Aging, we got together and combined and aligned the age and dementia-friendly frameworks to promote one single framework of sort of the frequent flyer topics. This is all a menu of options for communities. As you heard Robin Lipson say at the outset, this is all community-driven. So from that engagement, communities choose what is most important to them. We've taken some liberties, expanded some areas, and added some things, and you'll notice that access, equity, and inclusion is called out. While it's definitely a cross-cutting theme across all of these different things, we want it to be called out so that folks will talk about it in their work on a local level. So again, communities can make up their own themes based off of what they hear from the community. We know about the city of Salem adding volunteerism as a distinct focus area, the city of Lawrence adding people that have immigrated from other countries and country of origin being a determinant on how you perceive aging, perceive health and wellness information, how you access different things in your community. So again, being community-led is really the only requirement, and asking people, what does age and dementia-friendly mean to you? But we hope in going through all of this that being equitable, inclusive is just part of the process. To help with that, we also created an age and dementia-friendly integration toolkit. We jokingly call it the toolkit to end all toolkits. There's lots of tools and guides, but if you're coming at this movement from either age, dementia-friendly, or both, we have all kinds of resources to help you kind of support your movement, and access, equity, and cultural inclusion is one section of this guide because it's one focus area of our framework. So we have guides, and you can see, well, you can't see, but we have AF for age-friendly, DF for dementia-friendly, and AF and DF for both. So if you're wondering which elements you can sort of promote equity and inclusion in, these are some resources, research, reports, just things to inform and raise awareness and to help you along in that process. Not the be-all, end-all, but we are always adding to this and always kind of developing this toolkit of toolkits. And speaking of which, we try very hard not to create our own additional toolkits. Sometimes we feel like it's necessary. And so over several years, we have created a guide to help promote equity inclusion in the age and dementia-friendly movement that is called Healthy Aging for All. We have piloted this in Framingham, the Pioneer Valley, and Lowell. We've made changes to the guide, and now we are working on a new version, the 2.0 version of this guide. And with the centerpiece, again, being a crosswalk, and along the top, you can see sort of icons of the focus areas of being age and dementia friendly, transportation, housing, social inclusion, and so on. And then on the vertical axis, you can see different population groups with sort of a blank category for both a custom focus area, and if you feel like a population group is missing from this, you can add that and talk about it. One thing that was really clear in developing this guide was to not have check boxes to say, well, we've checked off the intersection of transportation and dementia and disability, or so on and so forth. We have just icons that are run throughout this crosswalk, and this is meant to be a conversation guide for communities to say, if you've identified and prioritized transportation or housing as part of your local process, we need to think about how different populations are included, are engaged as in part of the process and included in the action plan. Have different populations been surveyed and been included in the process? So this is our way of at least encouraging communities to have these conversations, not to check boxes, but to continually kind of have a reference for your work to just be more inclusive and equitable. One set of feedback that we got as part of piloting the guide was that people wanted some discussion questions and examples of inclusive policies and practices. So we have those as part of the guide that you can look at. I'm not going to go through them, but a lot of this comes from just different work that communities have done across the state, whether it's in digital equity, improving food access, fare-free transportation, and all of the things that communities have kind of churned out as part of, getting feedback from residents and thinking about how it can be more inclusive. So in doing this is why we have Carlene and Marvin here, to bring more of those examples to the forefront and also bring you ways that you can get involved in policy and advocacy on a local and statewide level. You also saw the Reimagine Aging report and those cards. So we have sort of a bonus story on top of the state report, which comes from some great work from the Public Health Institute of Western Mass. They came out with a report, again, funded by Point 32 Health Foundation. Yes, the theme continues, on healthy aging with a criminal record and the barriers that creates, as far as this report's concerned, mostly to housing. But you can listen to this podcast audio story, and if you go to this page, which is on our Equity and Aging webpage on the MHAC website, you can see some fact sheets on some legislation that's pending, joining conversations of different coalitions, and how to get involved in what is mostly about sealing queries after a certain amount of time automatically, not putting the onus on the individual to go through an onerous process and paperwork and so on and so forth. It's just to have it be a thing that happens so that you can get a job. You can have all access to just different things. So I encourage folks, along with the other podcasts, to listen to this one as well. It's a great story with a lot of other tools and resources and research. So that's what I have. That's my lightning round of what we've been doing to promote at least the conversations around equity. But now it's time to have folks present about some of the action being taken across the state. And so who's going first? You want to rock, paper, scissors? I'm gonna go with Carlene first. Okay, I'm gonna bring up Carlene Pavlos from Mass Public Health Association.
Hi, everybody. Happy Thanksgiving. No, what's that holiday again? Halloween. Happy Halloween. That's why I put a pumpkin up there. Plus, it matches our colors at MPHA, blue, green, and orange. Oh, this is a great view. It's really nice from here because I get to see so many of the partners that we work with on some of these issues. I'm going to name a few of them, but this is not an exclusive list. I, too, am going to call out Point 32 Health. It's great to see you here, Philip. Of course, the Mass Healthy Aging Collaborative, AARP, the Western Mass Public Health Association out there. Laura, thank you so much for being here. And others, you know who you are, long-term colleagues. And then there are others that are just to-be colleagues. Oh, Walk Massachusetts, hi. So I told you I would miss some. It's great. It's just great to be here. And it is also really good to be here talking about age and dementia friendly. That slide that James had just put up with all of those different dimensions of age and dementia friendly, you could just get a sense by looking at that of how interconnected they all are. They are not, we call them out separately, but they don't work separately, not in people's lives. As people try to live their lives in community, I'm going to be talking about this, but like transportation and social isolation, you can't divide those things apart. Equity and inclusion in housing, you can't, these things are all interconnected. Mike talked about it a little bit in terms of policy, that what kinds of policies and practices, which, by the way, policy is our love language at the Massachusetts Public Health Association. I steal that from Ayanna Pressley, I will admit. But we think about things like equity in all policies and public health in all policies, and I think it's important to think about age and dementia friendly in all policies so that we're trying to embed them in all of our different policies. Oh, I can move on to the next. So I'm going to tell you a little bit about MPHA before I tell you about our work. So we are a statewide not-for-profit organization. This is our mission. We're a champion for public health. We work to be a catalyst for change, real change in the community, and we focus on eliminating health inequities and creating healthy communities for all people in the Commonwealth. We have two primary commitments. The first is dismantling structural racism. So at MPHA, we care about inequities and we use a leading with racism lens, and then we get intersectional from there, thinking about other kinds of inequity like ageism, homophobia, gender oppression. And we also are really committed and have practices embedded in what we do through what's called our health equity policy framework for listening to the voices of those who experience health inequities at the greatest levels as we design our policy priorities and the specific policies that we endorse or advocate for. So here are some of the key things that we work on. We have been involved for years with some partners in this room on transforming the local public health system. There are 351 local boards of health in the state of Massachusetts. Did you all know that? I did. Okay. That is more than, Texas or California, right? We're this tiny little state. We have more local boards of health than any other state. And as you can imagine, that leads to a lot of inequity, right? Like the small town of Florida, Massachusetts, and the big city of Boston, Massachusetts, have the same responsibilities, same statutory responsibilities for local public health. So we have been working with allies in the Coalition for Local Public Health to transform the local public health system. And I could not help plugging a very specific bill, SAFE 2.0, the statewide accelerated public health for every community bill. And it's pronounced SAFE 2.0, not SAFE 2.0, SAFE 2.0. And it is making its way through the legislature for the second legislative cycle, I will say. And this year we expect, it just was reported out of healthcare financing, and we expect passage of it this session. And then there will be a lot of work to do to implement it, to create a public health system across the state that is more equitable and more efficient and effective, right? We just saw what happened during the pandemic, not having an effective and efficient and equitable public health system. We can't allow that to continue. If you have questions about that, it's one of my favorite things to talk about. We also work on social determinants of health, or what we call the fundamental building blocks of good health. Things like clean air and water, we talk about it as environmental justice, things like having a safe place to live. You can't be healthy if you don't have a safe place to live. So we do a lot of work around affordable housing and homelessness prevention. If you don't have nutritious food that's feeding your body, you cannot be healthy. So we work on the food system and making sure every community has healthy and affordable food. We do a lot of work on transportation, because if you can't get to school, if you can't get to work, if you can't get to medical appointments or have access to transportation for social interaction, you are not healthy. So we work on public transportation, and I'm going to be talking so much about that. And then we do work with the healthcare system to move, to try to harness their power. You know, healthcare is pretty powerful in this state. They hire a lot of people, they have a lot of political power, and we work with that system to try to move it to think more about prevention rather than just treating the downstream impacts of injury and disease, to really think more upstream, and to work with the state on developing payment models that are more likely to pay for health-related social needs, so that if you need food, you have a way to get it through your healthcare provider, just as an example. We think that all of these things are integral to having the kind of thriving, livable communities for people across the lifespan. And so I'm going to tell you a little bit about the how we work part. We always try to work in partnership, and we have 3 primary ways that we do that. One is in convening coalitions, where we literally bring people together and organize communities and groups of individuals to identify solutions and take action. So we convene coalitions. There are already existing coalitions, particularly those that represent people who are closest to the problem. And in those cases, and we do this especially around our homelessness prevention work, we do solidarity organizing. So we get behind their agenda. There's a coalition called Homes for Families. We get behind their agenda for tenant protections and use our voice and our reputation at the State House to try to promote the agenda that they have already identified to help keep people in their homes. And then we also do capacity building. So there are a lot of important issues out there, some of which MPHA can't take on, believe it or not. We're 7 people. So there's a lot of social justice work in the world to do, and we cannot do it all. And there are lots MPHA. I am not the person who is doing most of this work. And the person who does, one of the people who does a lot of this work was supposed to be here today, but had a family emergency in Baltimore. So I'm using her slides and using the pronoun we. Remember that it's really not me. She and her, so I will name them. Alexis Walls, Janeska Roman, and Omi Amarasingham, who are our policy and campaign team, are really the women. Oh, and our newest member, I almost forgot, she's been with us less than a month, Kate Forrest, are the women who are really doing the work at MPHA that I'm describing. So I am a stand-in only, and I should have said that at the very beginning. And it is they who do this partnership work. So now I'm going to tell you a little bit about our work in the area of transportation and why we're doing this work in the area of transportation. I'm trying to remember, probably 8 years ago, identified an enormous challenge in public transportation. It may actually have been longer ago than that, which is with our regional transit authorities. How many people know what RTAs are? This is excellent. Don't always get that in an audience, so I'm very glad to know that. A lot of people are familiar with the MBTA, which is the Metropolitan Bay Transportation Authority, the T in Boston. And you know, like I take that every day, kind of a disaster. I'm trying to think of a polite word to describe it, sorry. Kind of a disaster. Well, in regional transit across the Commonwealth, there are 15 other RTAs across the Commonwealth. What public transportation means is a bus on a fixed bus route that generally doesn't work on the weekends, doesn't work past 7, or sometimes if you're lucky and live in a particular area on particular routes, it might run it till 9 o'clock at night. In rural communities, there's barely any service. And in some places, there's literally no transit service. RTAs, by the way, get 7% of the transit dollars from the state budget and serve more than 50% of the state's population. So, in other words, we have a huge problem with regional transit, public access in Massachusetts. And think about what a huge issue, you probably already know. Anybody who actually works with older adults that are served by RTAs know that it is wholly inadequate to meet people's needs. How are older adults going to, get to medical appointments? How are older adults going to stay in touch with friends and travel to their houses, go to church or synagogue or to a mosque if they don't have a reliable way to get there, let alone the dream of point-to-point transportation? This is fixed bus routes. Okay, so that's our challenge. That's the problem. So we decided to use the pattern of convening coalitions, and we began to work to organize what is called the Regional Transit Authority Advocate Coalition, or RTAC, because public health uses acronyms for absolutely everything. It's a rule. So the RTAC is a group that MPHA and our allies in T for Mass, Transportation for Mass, have organized. It's a group of community groups, human service providers, transportation advocates, and some riders who have come together to really organize and build a voice for RTAs in the state. And that, you can see the vision statement here. It's, crazy. We would like to have a Commonwealth where all residents have access to transit that gets them where they need to go. Crazy. It's so pie in the sky. In 2018, just a bit more background, there was a task force on RTA performance and funding, and it made 24 recommendations. But when you boil it all down, what they are really saying is that we can only implement those recommendations and innovate and expand and meet the transit needs of RTA regions if they have funding. Predictable, stable funding, not like grant funding that will let you do a fare free pilot for a year, but stable ongoing funding. So we came up with a bill. Policy, remember I said it's our love language? Well, it gets written into bills, and this bill is House 3272 and Senate 2277. Our sponsors are Rep. Natalie Blaze and Senator Sue Moran. They're incredible champions for this bill. So this is the bill. The point of the bill is to raise the floor for annual funding to RTAs to $150 million, to identify community needs and use those resources to respond to the specific routes and timing that people need, to invest in the infrastructure of transit statewide and try to do some interconnectivity between the RTAs, because I should have mentioned, you're in one RTA and that is the only, you can't travel to another RTA. That's not a thing. That's not a thing. We can't travel across Massachusetts. We stay in our own little regional areas. And a huge thing for RTAs is that we have to stop equating their ability to generate a profit with what it means to be successful. Because what it means to be successful is getting people where they need to go, not generating a profit. This is public transportation, right? Okay. So we've done a lot in the last year. This is a list of some of the things that RTAC has done to organize and build voice. We have done a lot of outreach to get more co-sponsors for that bill. Many of you know this, but if you want something passed, one of the strategies you have to use is getting legislators to sign on as co-sponsors to your bill. We've done a lobby day at the State House. We organized with Mass Inc. to do a statewide poll and found that 79% of the residents of Massachusetts do want to see investment in regional transit authorities, and that has helped us in our outreach to legislators and getting people to sign on. We've done budget outreach, and we successfully got the House Progressive Caucus to name this bill as one of their priorities. So, in a prelude to getting that bill passed, last spring, we had an enormous and just critical budget victory. We got $184 million for RTAs in the budget, and by we I mean RTAC. $150 million, we met our floor for operating budget. That felt like a miracle. So yeah, you could, James was about to clap, do that. It is really huge. And on top of that, there are pilots for fare free, $15 million for fare free pilots, as well as $19 million for transit innovation grants. But those, again, the critical thing about those is they're nice, but they're on top of the floor, that floor operating budget that we really needed. So I am done now because I think I already went past 15 minutes. So if you are interested in anything that we do, join us. You can follow us on our social media. You can sign up for our newsletter, which is super simple, mapublichealth.org, or you can email me. Okay.
Thank you very much, Carlene. So hopefully people are getting the hint that all of these issues that seem really large and overwhelming, there are partners across the state doing this work. There are grant funding opportunities for local projects, but there's also statewide coalitions that you can join to get part of a movement to kind of enact change on a wider scale. So Robin also at the front of this whole agenda mentioned the secret sauce, which is community-based feedback. Another ingredient in the secret sauce are folks like Carlene and Marvin that take this action that we can rely on to refer people to. We are here connecting all over the place to organizations like Walk Massachusetts that do a lot of this work. And another organization that does great work is Tech Goes Home. So Marvin, I know you have, like Carlene, about 10 jobs at the organization, so I'll let you introduce yourself. But Marvin Venay, everybody.
Good morning, everyone. You doing all right out there? All right, look to somebody next to you and say hello. Okay, all right, good. I know how excited you are to be here, and sometimes we get trapped up in our daily activities that we lose sight of the people next to us. And so I think it's very important that we recognize each other at times, even if it's not more than just a hello, but that acknowledgement goes a long way, all right? So again, as has been shared, my name is Marvin Venay. I am the Chief Advocacy Officer at Tech Goes Home. Very grateful to be here with you all today and to talk about this important work. I want to, first of all, acknowledge AARP, the Massachusetts Healthy Aging Collaborative, Point 32 Health, along with the Mass Public Health Association. Carlene, thank you for that amazing presentation. You're doing some great work. I will tap you for a couple of the financial access points that I'm looking for. So let's talk a little bit about digital equity, and let's talk about its importance and how it's significant in this room. I'm going to ask you one question. Digital equity, summarize it in one word. I'd love to hear your thoughts. Anyone could go popcorn it anyhow you choose. If anybody has it, raise your hand. I'd be happy to grab you. But digital equity in one word, what does it mean to you? Yes. Access. Connection. Reliability. Comprehension. Information. Communication. I'm sorry? Productivity. Okay. Affordability. Network. All right. All these things are exactly what is required for us to create digital inclusion. And we need this on an ongoing basis. At Tech Goes Home, we understand the value of digital access and we bring it to all ages as much as we can, including our elders particularly. And the people that we serve anywhere range from ages 3 upward to 97. The oldest individual that we have serviced was a 97-year-old man who was a Tuskegee Airman. And he learned how to use a device very happily, very excited. He was very overjoyed the fact that he had this tool in front of him. And as confusing as it appeared to be initially, he walked out of that conversation overwhelmed by the access that he had at that point. For 20 years, TGH has been working to advance digital equity and to close the digital divide for the most vulnerable communities. Our programs were born in Boston, but now we reach thousands across the state from North Shore to Pittsfield. We're focused on 3 legs of digital stool, as we call it: a device, training, and internet access. We afford those that we serve with each at no additional cost to them to alleviate any burdens that might exist and their imagination as it relates to getting access. Our programs are intergenerational, as I discussed. We work with nonprofits, schools, senior housing, co-op libraries, you name it. If it's a community-focused organization, TGH wants to partner with it. Now let's talk a little bit about digital equity in health. Yes, I do. I'm going to get to it 1 second. Thank you. Those facing, in context of our conversation, one of the challenges we're intent on solving is the impact of digital inequity on health, physical, mental, and emotional. Those facing these barriers of digital access include the BIPOC community, low-income communities with aging adults, and increasingly also face the challenge of healthcare challenges, including inability to schedule medical appointments, request prescription refills, talk with a doctor, or access health resources and support online. All things in which everyone in this room is quite familiar with. These are benefits of the internet that I'm sure many of us take for granted sometimes. I'm sure we've seen the advancement that has happened since the pandemic, but we also understand that it's not just healthcare. The internet has increasingly become a tool for socialization. Research says an integral to the mental well-being of our adults is actually having access. During the pandemic, platforms like Zoom and other essential tools became the face-to-face for friends. We all became neighbors very quickly by the usage of Zoom and other platforms of that nature. We were overwhelmed by isolation, but the internet gave us an access point to alleviate that strain in our life. Many of us were able to talk with our family members. Going. I don't know about you, but how many of you watch movies with family over the internet? How many of you play games with each other over the internet? We did everything we possibly could to stay together and keep family going. But there's hundreds of people in Massachusetts who don't have that as the outlet today. As this presentation on health and aging points out, depression is one of the most common mental health diagnoses among other older adults, which can quickly spiral into other ailments. They made the digital divide for older adults. 161,000 lack cellular internet access. That's 3.8%. 166,000 individuals 65 plus lack cellular internet. That's 13.7%. And then there's 48,000, I'm sorry, there's an error here, 4,899 between 18 and 64 that lack any computer of any kind. And that's 1.2%. Now you might say to yourself, these numbers aren't as high as I thought they might be. But 103,000 individuals of 65 plus lack a computer of any kind. While it might not seem alarming to you, imagine being on the side of it. Imagine being the individual who doesn't carry a device or have access in any sense, and they're trying to navigate the world as it exists. They might seem small, they might seem minute, but they're actually pretty great. They're actually of great value. And as we think about this work, I want to talk to you a little bit about digital equity and healthy access. Seniors unready for telemedicine before it happened, 71% were at Latinx, 60% Black elders, 32% white elders. When you think about Medicare recipients, 41% of them don't have access to a laptop or a computer with high-speed internet. I want to underscore the high-speed internet aspect because sometimes we are happy with access, but the access is inadequate, which doesn't allow us to actually function at our fullest potential. And what this means, we already know, ages can't access their health resources, seniors are unable to learn about or apply and manage their government benefits, and then seniors become ever more isolated and cut off from their loved ones. TGH, Our true North Star is to empower communities to have access and use digital tools to overcome those barriers. We simply want to end the digital divide. That is our goal. Let's talk a little bit about who we are. 20 plus years ago, we started an Easter Mass in the city of Boston. We were very fortunate to have a relationship with the city of Boston at that time, under then the leadership of former mayor Thomas Menino. Under his leadership, TGH started to begin this work, but it wasn't until the pandemic that everyone wanted to listen on why the digital divide was something of value. It wasn't until we got locked in our rooms and locked in our homes that we started to recognize that the internet access was the critical element to our success. We've been very fortunate, 22,000 plus graduates. We have well over 200 plus certified instructors. We do a trainer-trainer model in an effort to ensure that the people that we're partnered with actually get what they need out of it. So how does it work? We'll partner with an organization. We will train them how to develop curriculum that is applicable to the people they're serving so that it ensures that it is culturally responsive and not something that is just a template, but something that is necessary and valuable to those people involved. 88% of the people we serve are people of color, 90% live in very low incomes, and 53% are English language learners. Here's something to underscore. We work to ensure that our curriculum is put in the language, the native language of the people that are being served, so that they are learning in their native tongue and not being expected to learn under English terminologies that they're unfamiliar with. And here's our formula of impact. You'll get an iPad or a Chromebook. You'll get an internet access internet program that is either through a hotspot or through an Internet Essentials program that we use. You find it interesting that many people take the hotspot more than they take the Internet Essentials hardware. Does anybody know why? Mobility matters, correct. And then we give you 15 hours of that digital training that's been discussed, and this is what we consider digital inclusion. Our impact on older adults, 3,266 older adults served in the last 5 years. 11% of our TGH graduates are older adults. 246 courses run serving older adults in the last 5 years. Our impact on health, pandemic, 70% were able to use telehealth because of TGH. The important part here is that I think doesn't get underscored. Not only did they get access, but they didn't have to catch a bus. They didn't have to find the money to catch the bus. They didn't have to worry about dealing with a receptionist that wasn't happy to be at work that day. They didn't have to worry about the constraints of sitting in the room waiting until a doctor was able to come in and meet with them. 70% of them were able to function using telehealth. 77% use their devices and their digital skills for health and wellness. And 79% access to vaccine information. We all know that the vaccine product came out, and when you started to try to register, there were problems. Am I wrong? I don't know about you, but it took me 3 times to get an actual test, and I was sick, okay? But seniors were able to use this device and be able to access points. And then 97% of them reported that they learned skills that were useful during their course that improved their lives. Let's talk about partnerships. I'm gonna take a pause and say this real quickly. You're moving so quickly, you don't recognize actually what's going on. I don't know about you, but my calendar gets so full at times that there's times I don't even recognize where I'm going. I just know I have to be somewhere. This is one of those days. I walked into Hogan, did not realize I was walking into Hogan. I even ordered the Uber, so I should know that I'm at Hogan, but it didn't process to me in just 2 seconds ago. But needless to say, I want to say, yes, This institution has been great. I'm glad that we're here. I'm excited about the work that you all are doing, and I will jump back into my presentation now that you all have dealt with my little blurb there. Partnerships. This is an area that I think we can do better at. We're doing great, but we can do better at. TGH wants to partner with organizations that are on the ground making impact in lives in gateway cities with people who are restrained by the system. What is the system? If they are dependent on anything as a resource for their livelihood, that's a part of the system. Our goal is to create enough equity in the digital space that they will no longer be dependent upon any system, and they will become self-sufficient to create success in their lives. How do we do that? Partnering with organizations on the ground, meeting them where they are, allowing to work with the people that they trust, coming in as a partner and not someone who knows how to do this, but someone who is willing to learn from the people we work with, will make the difference in the work. That wasn't me, I didn't do it. If you are an organization that serves constituents that have limitations in some capacity, low income, they're struggling to meet the demands of the world, they're looking for some support emotionally and mentally, we want to partner with you to ensure that they have the digital skills to access the resources that are out there for them, but also to find their voice and find their ability to grow in their current moment so that they can get to the next moment, which is their freedom and liberation. That's where we want to go. We want people to be free. Becoming a partner with us is not just you sign up, you register, hey, it's good to know each other. No, we actually want to work with you on what your organization values are, and we want to work to ensure you meet those goals as you go along in your journey. We want to make sure the people you serve are fulfilling your mission, and we want to do it collaboratively in the background, simply gently encouraging you and providing you the tools to be able to access all of the wonderful things that exist out there on the World Wide Web, as we used to call it, simply because we want to make a difference. And the last thing I want to tell you, when I think about this work, we do a lot of policy work, which has been described as policy is a love language for many of us. But it's not just the policy that makes the change. You have to be willing to sit with people, to understand them, to find out who they are, to find out why they're in their position, and to provide them with the tools to get them on the other side. If you are willing to do that, talk to us at TGH. We're willing. We want to reach as many people, and we want to reach them with you. Thank you. No questions? No questions. Just joking.
Thank you very much, Marvin. So equity covers a lot of ground, but we think between transportation, public health, and digital equity, our presenters managed to cover a whole lot of ground. So thank you very much to our presenters. So while technology does its thing, luckily we don't need it anymore. Marvin just snuck in by the finish line. Do we have any questions for Carlene or Marvin? Probably not me, but
Marvin, I was just wondering how you're funded. How do people pay for it?
Mike Fester. Mike pays for everything. No. We are publicly and privately funded, and so we get a mixture of capital. So we're doing individual donations. We're also doing the grants and so forth as well, and government support.
So those partner organizations, do you have them as each receive funds for perhaps that work in that community? Or you have this and then you decide to?
Excellent question. Can everyone hear the question? Was that a good
No.
question? Yes. Yeah, let me repeat it. So the question was whether or not we receive, or whether or not we give funding to the people that we serve. Is that correct?
Yes, so do you want partner organizations, do they then have to help you to raise that funding?
Okay.
To get that support?
Okay. There are some unique cases where a partnership in fundraising is very helpful. But there are a lot of cases in which our organizations do not carry that sort of level of finesse as it revolves around funding. And so we will find those resources on our own to be able to support that organization. We try our best to alleviate burdens at any point. And that is not only for the people we serve, but the organizations we work with as well. So to answer your question, typically, it is us coming in with some sort of, can we work collaboratively? But if it's not available to them, then we will identify the resources to support that program because we want to ensure that they get the actual access point to success on the other side.
Just as switching up here, one microphone. So at the Mass Healthy Aging Collaborative, we promote and put an age and dementia friendly lens on a lot of different funding opportunities that aren't explicitly for older adults. But we do our own repackaging of many things. Those go on our website that can support, folks and organizations buying devices at the very least, so that Tech Goes Home can come in with perhaps the other pieces of that puzzle. But there's all kinds of funding from councils on aging, all from different sources, and I'm happy to talk with folks about some of those separately too. So, and other questions? In the back, yes.
Given that it's a smaller population, as you were saying, is there a minimum that you have to have who need this to bring your organization in and do the training here?
Excellent question. So we would like to have courses that run at least 10 individuals, and we would hope to scale that. But we are willing to start with an organization wherever they are in an effort to get them on the ground because we understand that there is a development stage. And so knowing that there has to be a ramp up, we are more than willing to come in and try to serve as a thought partner on how you can execute some of that. Before I step down, are there any other questions for me by any chance?
Marvin, with regard to you mentioned earlier the 200 or so folks who have been trained
Yes.
to be helpful.
Yes.
What does that look like? Is that where you're relying on partners to essentially identify volunteers that want to be trained, or is it all internal to Tech Goes Home?
Excellent question. So the question is, if in case you didn't hear it, are we working to develop our own pipeline of instructors, or are we depending on the organization we're working with? Our goal is to train people at the organization who are familiar with the folks that are being served, because that trust is already established. It makes the digital equity training that much smoother to take place. Can you imagine someone trying to learn how to use a device and the person that's talking to them is quite unfamiliar with them? That is a very difficult moment and awkward for everyone. So we try our best to instill and empower those who are already being of service to these folks with the tools so that they can actually be the trainer themselves. And we are trying to also figure out how to identify ways in which we can create some regional trainers as well who can come in the case that an organization that is only size of 5 doesn't have the capacity for someone on their team to actually do the training but want to do the programming. We are trying to identify solutions for that at this time as well. And hopefully that answered your question. All right. Okay. All minds clear? All right, thank you all.